Okay, we have two chest x-rays here. Both are PA views. Which one is normal? The one on your left hand side is normal. The one on your right hand side shows signs of emphysema. The word emphysema means full of air. The signs of emphysema on a chest x-ray are increased lung volume, increased blackness of lungs, poor definition of blood vessels, decreased transverse diameter of heart, which artificially looks decreased because retrocardiac lung tissue becomes more radiolucent, means there is more air in lung tissue, and which sort of hides the left heart border. You can easily appreciate flattened diaphragm as compared to dome-shaped diaphragms here in a normal lung. Emphysema is described as destruction of alveolar walls, creating abnormally large air spaces that are not able to remove air and thus retain air even during expiration. This results in marked decrease in surface area available for gas exchange, and patient has to do labored breathing. Over the years, extra respiratory efforts increase the size of the thoracic cavity, resulting in barrel-shaped chest, which you should be able to easily see on a lateral view of this patient. So this is emphysematous lung, and this is the lateral view of the same patient. You can see barrel-shaped thoracic cavity, flattened diaphragms. An increase in AP diameter of thoracic cavity is also a feature of emphysematous lung disease. Let's see what happens microscopically to lung tissue. We have a lung tissue under microscope, a normal lung tissue. When nature builds a human tissue, it uses proteins as building material. Just like we use cement or mortar or wood to build a house, in case of lungs we have a protein called elastin, which along with a glycoprotein called fibrillin makes thread-shaped structures which are known as elastic fibers. So these thread-like structures are elastic fibers. Some of them are nuclei of the pneumocystis type 1 cells, but you can easily see these thread-like structures here. This one here. So elastic fibers make a network throughout whole lung tissue. We also have reticular fibers surrounding elastic fibers, which are not visible here. You need to have special stains to be able to see elastic and reticular fibers. The combination of reticular fibers and elastic fibers, along with some other components, make what is known as connective tissue or interstitium of lung. Within interstitium, we also have tiny blood vessels and lymphatics. On these frameworks of reticular and elastic fibers, nature attaches cells as bricks of mainly two types, namely pneumocystis type 1 and pneumocystis type 2. The pneumocystis type 1 are main site for gas exchange, and pneumocystis type 2 produce surfactant which helps in reducing the surface tension within the lung tissue. The cells are arranged in such a pattern that creates functional units of lungs, which is known as alveoli. Alveoli are similar to grapes in shape, and it is because of these elastic fibers that lung have elastic properties. Elastic fiber can stretch up to 150 times of the normal size, and they can recoil back to whatever the size was. Damage to these fibers. What happens in emphysema? These fibers get damaged, and damage to these fibers causes damage to alveolar walls, and two alveoli can become one as a result of loss of walls between them, and tissue is also lost, and the process can repeat several times, causing extensive damage to lung tissues, resulting in decrease or loss of lung function in a particular area. This condition is known as emphysema. It is most usually caused by smoking due to the presence of poisons in smoke. By the way, lung compliance should increase or decrease because of emphysema. It would increase as a result of loss of resistance by the elastic tissue. However, there is an increased airway resistance due to partial obstruction or damage to the airways as a result of smoking, for example. And lung compliance is defined as the force required to stretch the lungs and thoracic cavity. High compliance means lungs will inflate easily, but before lung compliance can increase, there is an increased resistance in bronchial tree, as I said before, that actually traps air inside the lungs and results in damaged alveolar walls. Thank you very much. Normal chest X-rays courtesy of Dr. Alex McLennan from UK. X-rays with emphysematous lung disease are courtesy of Dr. A.J. Chandrasekhar. Thanks to these two gentlemen. Histology slide is courtesy of www.lab.anhb.uwa.edu, and written permission has been obtained from all these uh, institutions and people. Thank you very much.